This is Dan Sosnowski, editor from Chiropractic Economics magazine, and I'm here with Dr. Mitchell Fine from Fine Wellness in Altamont Springs, Florida. Dr. Fine, you're here demonstrating the Neuromechanical Innovations IQ Adjuster. I understand you like using this adjuster in your own practice. Tell us a little bit about why you like it and how does it work?
Okay. I like the Neuromechanical Adjuster because it has a computer in it that gives feedback when you have the right line of drive and when you've reached maximal bone movement.
All right. So I see you have a sample patient here.
Right. So with this technique, we start with the knockless test, double knockless. And we look at the pelvis and look for movement of the SI joints. Then we'll do a single knockless test. And again, we're looking for fixations in the pelvis. And we're using testing that comes right from orthopedic textbooks. And that's cool because when I talk to medical professionals, they can see that this is something that is less foreign or not foreign to them. They can grasp what's going on pretty easily. Again, now I'm going to go and I'm going to check hips test. And you see we have fixation, internal and external fixation of the hip.
Right.
On the right and then on the left. We'll check and see how that goes. A little better on the external, internal is fixated. So he has a short right leg, and again I'm going to look for that fixation. His pelvis is high on the right. I've seen with some patients that in one treatment, sometimes the pelvis actually straightens out. I'm just going to make sure that he's lying straighter on the table. He's still a little bit high, but less high. So you always want to check patient positioning on the table because they're not always going to lie the right way.
So before you adjust anything, you make sure you know what it is you're adjusting and why.
Right. And I want the patient to know that I know exactly what I'm doing.
Very good.
And there's a method that the machine has been tested, and the technology is something that's really exciting, and it's non-threatening to them.
Very good.
So, see, again, now we've isolated the right SI is where you've got movement. Now I'm going to check for pain and tenderness in the SI joint. Tender? Danny? No? Okay. Tender in here? Excuse me?
The left side is tender, not the right.
Okay. Tender in here? Okay. So what I'm going to do is adjust to release the fixation, and the instrument shut itself off because the feedback into the instrument showed that the bone was moving better, and it automatically shuts off. Now I'm going to check and see how the range of motion is. Now he has soreness, and you see that there's less movement. The fixation has been decreased. Now he has tenderness on the left side, so I'm going to investigate that now, and then I'll go and check hips. Tenderness? Yes? Okay, tenderness here? Okay, so right here is a common area for tenderness in the SI joint. With this instrument, you can check the amount of newtons or force, and the instrument picks out the frequency, but the IQ does. So just reach in here like this. And again, it tells me that the adjustment was successful. Tells the patient the adjustment was successful and specific. And I can check, do you have tenderness now? Okay, is it decreased at all? It is decreased. Okay.
So it truly is an intelligent adjuster.
It's amazing. I'm having I've been practicing for 28 years, and I just find that I like technology, I like new challenges, and I like to see that I can do things that wow things. As chiropractors, we need a wow factor in what we do.
Very good. Well, thank you for giving us a demonstration, and I hope you enjoy your time here at the show.
Thank you.
Thank you, Dr. Fine. And if you'd like to learn more, you can come to the Neuromechanical Innovations booth or visit them online at neuromechanical.com. Take care.